I'm Ruth O'Regan. I'm a professor and chair of medicine at the University of Rochester. So overall, race and ethnicity are very important in terms of prognosis for breast cancer. So what we know overall is that African American patients and also Latino patients have worse outcome from breast cancer. Some of this is socioeconomic in that it's well established that they do present with later stage cancers. But the other thing that's very notable is the fact that there is a difference in the subtypes of breast cancer they get. So what we showed and others have shown is that African American women, particularly young African American women, have a higher rate of triple negative breast cancers, which we know, of course, are aggressive breast cancers with not as many treatment options as the other subtypes. So in Atlanta, we looked specifically at women under the age of 55, both Caucasian and African American. And what we found was that in women that were under the age of 30, there was probably an equal instance of triple negative breast cancers between the African American and white patients. But once they got older, there was this continued disparity where the African American women were 50% more likely to get triple negative breast cancer compared to the Caucasian women. And this has been shown by a number of other groups as well. We also showed that actually African American women with triple negative breast cancer have a worse outcome than their Caucasian counterparts as well. The other thing that's been noted by a number of groups is that if you look at estrogen receptor positive breast cancers, African American women have a worse outcome from estrogen receptor positive breast cancers compared to Caucasian women. We're not really quite sure what the reason for that is. We looked at the 21 gene recurrence score assay in our patients actually in Atlanta. And what we essentially found was that although the median 21 gene recurrence score was similar between African American and Caucasian patients, African American women were more likely to have tumors with high recurrence scores. So biologically, they may get a more aggressive estrogen receptor positive breast cancer compared to the Caucasian women. So it really is quite a disparity, and some of it is definitely, as I mentioned, related to them presenting later with later stage disease, which is something we should be able to fix. But there also appears to be some kind of biologic, or at least it appears that for whatever reason, African American women actually tend to get more aggressive breast cancers as well.